The concept of stress generally refers to the physical or psychological events capable of disrupting homeostasis. In order to investigate the role of hypothalamic pituitary adrenal axis in depression prevention amongst pre-medical students, participants will be recruited on a convenience-based method of sampling from a distinct representation of pre-medical students at Hampton University School of Science. The researchers will recruit 60 students enrolled in Hampton University School of Pre-Medical Science program. To ensure all levels of students are represented, the researchers will recruit 15 first-year students, 15 second-year students, 15 third-year students, and 15 fourth-year students accordingly to participate in the following research analysis. All participants will be asked for consent via Total Wellness to receive 2 blood tests and participate in a series of questionnaires prior to the pilot of Tap Out of It. Medical students are known to experience high levels of stress due to their rigorous workload, high demands to succeed, and very little social support throughout their tenure. The researchers will assess stress levels in participants using a 15-item questionnaire to indicate their emotions and thoughts as it relates to stress, both outside and in their medical courses. The following study, utilizing the free smartphone application Tap Out of It, will be conducted at a historically Black college and university located in Hampton, Virginia. The researchers will conduct the study over the course of 1 month, particularly from October to November, in order to assess stress levels during midterm examinations. Stress is followed by increased cortisol secretion and acts as a negative feedback mechanism on the pituitary gland and the hypothalamus. The most important physiological effects of cortisol are the increase of blood glucose levels and its anti-inflammatory and immunosuppressive action. To accurately measure cortisol levels in participants prior to the mobile application pilot, a blood test will be administered based upon appointment starting October 1st. While participants are waiting on their appointment, they will be asked to complete the Aga Khan University Anxiety and Depression Scale to assess their current level of anxiety and depression. Each participant must be cognizant of having their blood tests administered at the same exact time to adequately assess their cortisol levels in their bodies. The cortisol status of each participant will be used to diagnose the function or malfunction of the hypothalamus, the pituitary, and the adrenal gland. The completed Aga Khan Anxiety and Depression Scale will be turned in to the researchers prior to leaving the clinic. Participants who score 19 or higher will be considered as currently suffering from anxiety and depression. Similar to the Happify mobile application, Tap Out of It will be a self-guided app that will aim to increase positive emotions through games supported by mindfulness research. Users will be able to access their patient health questionnaire upon downloading the mobile application. This questionnaire will be used to suggest a tailored track for an individual's use and subsequent activity content to reduce worry and cope with obstacles affecting pre-medical students. Participants will follow up with a post-blood test examination on November 1st at the same exact time listed on their initial screening tube. Upon completion of their portfolio, which will include their October 1st and November 1st blood samples, Aga Khan University Anxiety and Depression Scale, exit questionnaire, and mobile application results, the participants will be thanked for their time and will receive extra credit in one science-related course for their cooperation. The purpose of this study is to design an app that lowers or prevents depression levels among pre-medical students at a historically Black college and university. The present study was designed to further extend the exploration of self-guided app development, maintaining the homeostasis of the HPA axis and reducing depression in pre-medical students. The researchers hypothesized that chronic hyperactivity in the HPA axis may explain the longevity and symptoms related to major depressive disorder in pre-medical students today. Cortisol by the adrenal axis in the brain will decrease levels of depression and increase productivity in pre-medical students. These findings, along with the prevalence of mobile application in our generation, should be considered in further research and the discussion of HPA axis, cortisol levels, and depression levels amongst college students.